Hello everyone. Today we're gonna do a demo of the CHT application of a medic that was developed in some region of West Africa, especially in Mali, where the Ministry of Health adopted this tool. So the demo is mainly focused on the longitudinal follow-up workflow. And what is the longitudinal follow-up workflow? It's a continuous repeated monitoring of risk factor or health outcomes of a population over time. So it collects data that are part of a health program conducted by a non-governmental organization such as the WHO, the World Health Organization, or MSF, Médecins Sans Frontières, for example. So this information can be collected by their agent, and in that moment, we're going to grant them access to the application for them to collect all this information about doing the longitudinal follow-up. In some other cases, it can be part of the activity of the CHW, which is the case in our example. So in Mali, it's the CHW who collects this information. So for Mali, it's especially for children that are under 5, and it will track the birth registration, the civil registration, collect all immunization information and vital diseases that are part of the program, the health program. So, yes. So now, this CFT application, as I mentioned, it's available on Google Play Store and can be downloaded by the user. So once downloaded, this application can be used offline. So by that, I mean he don't need an internet connection to use the application. However, once a month, we recommend him to have an internet connection in order to sync his data with the server. So now, this mentioned, let's log on and see how we can do the longitudinal follow-up. So I'm gonna log on as a CHW. So I'm gonna enter my username here, and I'm gonna enter my password. And here we go. So, and then click on logging. But before clicking on logging, as you can see here, this application can be available in many languages and even in local languages. For example, in Mali, it's Bambara, the local languages, so we can select it. And in East Africa, it's Swahili, the local languages, we can select it. Or in Hindi, in India, and Indonesian for Indonesia. So depending on the local language, we can customize the application. Here we're gonna stick to English, so I'm gonna click on login, and now I have access to the application. So as you can see on the top, we have a three tabs: the task, the people tab, the analytics. So those are the tabs that will help the CHW to do his work. So I'm going to start with the task tab. The task tab, it's really all the tasks as its name, all the tasks that the CHW need to do. For example, if he did a follow-up in the past or an assessment, so this will appear here for him to remind him that he needed to do an action. For example, here it's a vaccine follow-up that he needed to perform. The people tab, it's where you can see all the contacts of the CHW. So you will see the member of the family, the concession, the villages, everything, the contact in order to do his follow-up. The task, the analytic tab, it's the dashboard, the internal dashboard of the CHW. So from this screen, he will be able to see all of his, to have some metrics, some statistic of his work. Everything that he did during the past month, depending on the period that was set up, he will be able to see the information, the cases of diarrhea, children detected malnourished, and newborn declared to the civil registration, for example. Okay, and as on my top right, there is a menu. This is the menu as it name, but this is where he can sync his data. Remember in the beginning, I said this application can be used offline, but once a month he needed to connect to internet in order to sync his data. So this is where he can do that. As soon as he have an internet connection, he go to that menu and he click on sync data, and it will populate all his data from his phone to the server. And you have other button, the guided tool, where it will explain him each tab of the application about the information. It's some information about the system, the version. This is to the other one is report a bug. It's in order to report a bug, there is an issue, so he can click that button. And the last one is log on. So I'm gonna go back to the people tab in order to do the longitudinal follow-up. To do the longitudinal follow-up, you have to go to the way it works here. It's you need to create a member of a family, and it will trigger automatically a longitudinal follow-up. This is part of the workflow of the Mali. This is how they design it, but it can be adapted depending on the partner or the country. They can change their protocol. So we're gonna go and into this village in order to create a new member. So I'm gonna go to the concession Abdoulaye Touré, then to the household Ibrahim to Traoré, and then I'm gonna create a new person. I'm gonna click here. So I click on the button new person. So they asking you what type of a person. So is that person is living in the community, or that person is living outside the community. So depending on the type of person that you would like to enter, so you have to choose. So I'm gonna put the name. So her name will be Aisha, and the last name Traoré, and the age. So I'm gonna choose the date of birth. So um, let's say in to go back a little bit to before. Sorry. So let's say 1 years old at least. Yeah, January. So yes, here it's the name, and this button it's when you don't know what the date of birth of the person, so you have to enter it manually. So she's a female, and we have to enter the birth certificate. So that's the child have a birth certificate. If I click yes, and there is some protocol saying was that declaration was made within the legal time, which is 1 month. I can say no, for example, or put a date. So I can say that she received it. This is just a few days ago. So does the child have a disability? No. Who is taking care of the child? Let's say the mother, and her name is Ramat Rama Rama Traore. And they always ask you to enter the contact number of that person. This is an 11222344. It's a 4-digit number. And then I click submit. So now you can see the summary. So Aisha Traore was corrected with the phone number and the birth certificate. And as you can see here, automatically there is a task for the child longitudinal follow-up, that was a trigger. So we're gonna go back uh, to the task tab, and we should see a new one. Yes, we see it, Aisha Traore. So we're gonna start. So you have some general information. So this form is especially for children between 1 to 20 months. So I'm gonna click next. I'm gonna do a follow-up and click on next. And when this was due, it was due today. So I'm gonna click on next. Was the child was present? Let's say yes. And the first thing we ask it's the vaccination or the immunization follow-up. So they ask you, okay, does all those vaccine was done? You can say yes, and if you say yes, they will ask you when it was done. So for testing purpose, I'm just gonna put it there, and here no, no, no. You can say yes to if you want. So it's just for testing. So let's go. So and this list of vaccines depend on the age of the patient. So if the patient is 2 years old, so the vaccine list will not be the same. So okay, there is a lot of vaccine. We're almost there. So no, no, no. So as you can see at the end, you will see the vaccination is not up to date. So click next. And the second part, it's does this child have a warning sign that you can see? So, so difficulty when he's walking, let's say no. He has some wounds that you can see, let's say no. He does not have an explained change of his behavior, let's say no. And here we're gonna check how will the child move, his motor of development. So he stand well. Let's say yes. He walks on all four. Yes. He walks with help. No, he doesn't walk with help. He can stand alone. He can walk alone. Click next. And now we're gonna check the breastfeeding that Aisha still doing breastfeeding. We can say yes, and they can ask you a question about the type of food, breast milk or cereal. Let's say yes. So all of this nutrition information. So the beans, legumes, yeah, dairy, yes, meat and fish, yes, eggs, yes, some fruits and vitamins, and other fruits or vegetables, no. Number of go food, let's say five, so the total number. This is just, you can see there is an error, so it has to be between 0 and 4. So this is another example of the CHT. So you have some constraint, and it's always show you if you're making some error that it is not okay. So we're gonna put the 4. Click next. And this is some prevention of anemia. So we're gonna ask, does the child receive vitamin A for the past 6 months? Let's say yes, and you have to specify when it was received. So let's say the day before. Have the child received micron powder? You can say yes, and has been dewormed in the last several hours? No. Now it's the malaria prevention. So we are on the section. So does the child has a mosquito net where he is covered during the night? So you can say yes, and sleep under mosquito net. You can say yes. Okay, so now they ask you what is the weight of the child. Let's say no, it's a lot, 6 and 60 centimeter. So this is the perimeter of the arm in order to check the Shakir band. So let's say it is green, and does is there any sign of a bilateral edema? You can say no and click next. Okay, now it's about the environment where the child lives. So does the household have some latrine? Let's say yes, and improve it additional. What type of latrine? Does the household have a hand washing facility? Let's say yes. So and does the household have a drinking water? Let's say yes. And have water storage device? Yes. And is there any, these items are in the household? You can say no, the presence of Android bed, the presence none. So there is none of that. But also, if there is anything about this part, those items, you can select them and you click next. And here, for example, we have selected that the child have stand with help, meaning that he need the help to stand. So this is a danger sign. This means that something is wrong. So some action needed to be done. But you will see the summary of everything that you did. For example, the has some birth certificate, the vaccination that he received, the improved Latin, the environment, everything. And also you have some special instruction based on the disease that the child have, the fact that he doesn't stand well, and anything that can be useful for the child or any program of prevention. This is where we're gonna put this information, and this comes with the protocol of the health protocol of the country. And here you will see the follow-up that there is a follow-up that you need to do. So as soon as you click submit, so it will submit the task, and the next month, because this is done every month, you will have to follow up to again do this task and to note all this information. So I'm gonna click submit. So thank you so much for your time on for this demo. I hope that you enjoyed. Thank you. Bye.